Daniel Johnson of the University of Nebraska Medical Center says his theory is that SARS-CoV-2 may be affecting the nervous system. So again, what's the main sentence?
The virus will
No, what's the main
affect
sentence?
the
No,
nervous
that is not
system.
main sentence. It says the main sentence is Daniel says.
Daniel says.
Yeah, that's the main thing. Daniel says.
Oh, Daniel says.
What does he say?
The virus.
His theory is, he said that his theory is that the SARS may be affecting the nervous system. SARS may be hitting the nervous system too. That's what his theory is. Theories means that you don't have proof yet. You just think this is what's happening.
Affect the nervous system. Nervous means you think.
Nervous is your nerve.
Your mind.
Your nerve, yeah, your nerves.
Okay.
That it can do so in some ways at least is hinted by the fact that some patients report a loss of sense of smell early on the infection. So why can you say that that's true? Because some patients, okay, what's the main sentence? That is hinted, okay? So that's the main sentence. That is hinted.
Huh?
The main sentence is that.
That is hinted.
Yeah, that is the main sentence.
Oh.
What is that here?
That is be infected.
The nervous, right. It's hinted.
It's hide.
No, hinted it doesn't mean hide. Hinted means it has a clue. It's hinted by. I have a clue.
It's hint. You can find out by the clue.
This is a clue. This is a clue.
Oh.
This clue is what clue?
Some patients have a
is a fact.
Low sense of smell early.
Yes. So some people lose their sense of smell. So they think, okay, if that happens, that means that they're attacking nervous system.
Okay.
There are some other signs too. There are other signs. Perhaps the virus has an effect on the part of the brain which tells the lungs to work harder when carbon dioxide builds up in the blood. Perhaps. So what's the main sentence? The virus has an effect. That's the main sentence.
The virus has an effect.
That's the main sentence.
Okay.
Perhaps.
Perhaps
means what?
It
Maybe.
Happen,
yeah.
Maybe.
What kind of effect?
They did effect on the brain.
Yes, and what does it on the brain?
They tell the lungs to work harder.
Yeah, when carbon dioxide builds up in the blood. So there's a part of your brain which tells you to breathe harder when you have a lot of carbon dioxide in your blood.
Okay, what the carbon dioxide I forgot.
We went up again. Oxygen breathe in, carbon dioxide breathe out.
So when 二氧化碳 build up in the blood,
what happens? Your brain tells you to do what?
Breathe hard.
Exactly. So because you're not breathing hard, what does that mean?
If you not breathe hard, you don't have enough.
I know that.
Oxygen.
Yeah, but why are you not breathing hard?
Huh?
So again, you go back to this main paragraph. So we read in terms of paragraphs too, okay, not just sentences. This paragraph is telling you what? The paragraph.
Affecting the nervous system.
Exactly, that's the main thing. It's affecting the nervous system. So now you go back to the bottom. The bottom says that there's a part of the brain which makes you breathe harder, right?
Yeah.
So then you go back to the top again. So what does it have to do with nervous system? And then you have to go back to this previous one too. So why doesn't some patients not have signal of short breath? Here it says the brain will give you shortness of breath because it tells the lungs to work harder. Work harder means you have to work harder. Okay? Because you have too much carbon dioxide.
Yeah.
But go back again. So why would we have this whole two paragraphs? Why we have that?
Maybe they explain why you already go to your lunch, but why you don't have the short
correct.
signal?
Yes, why?
Because they destroy your nervous system.
Where? Which part of your nervous system?
It's the brain.
The part of the brain, yes. There's a part of your head which tells you to breathe harder.
I don't understand. If the part of the brain tells you to breathe harder and you have the signal because you breathe harder.
Yes, that means because you're not breathing harder, what does that mean then? Okay, yes, there's a part of your brain which tells you to breathe harder.
Yeah.
Because you're not breathing harder, what does that mean?
Some part be destroyed by the
virus. That's right. Yes, so part of your brain got destroyed by the virus.
And part of them still work.
whatever it says here, maybe the virus has an effect on that part of the brain. The virus has an effect. Effect means attack.
Oh, I understand. So the gas, maybe the virus attack the part of the brain. Which brain? The brain can tell you to breathe harder, but this part be destroyed by the virus. So you cannot breathe harder. That means you don't.
Yes, it should be breathing harder, but the doctors are wondering why you're not breathing harder.
Because the virus
destroy the part of the brain. Yes.
Cannot tell you to breathe harder.
Yes.
Okay, understand.